across the nation, hospitals are bracing for another influx of patients as COVID-19 cases surge to records seen earlier in the pandemic. Nisa Ernst is a nurse manager at Johns Hopkins Hospital, and she's joining me now from inside the facility in Baltimore. Nisa, what's the situation like in hospitals right now? What are you seeing at Johns Hopkins, for example?
So good morning, Tim. What we're seeing at Johns Hopkins is what I call plan and pivot.
What does that mean?
We've been planning. That means that this next wave is here and that we've done a lot of planning in advance for this. But even the best laid plans need flexibility in order to change to meet the dynamic. I'll give you an example. We have opened a 23-bed medicine unit that was not open during our last wave.
Wow.
In the hopes that that's going to be able to take care of some of our non-COVID patients, right? And that's significant because this also means significant staffing increases. It also means going back to what we talked about previously, which is cross-training nursing staff to be able to meet a wide variety of clinical needs. And having that preparation in advance so that staff feel a level of competency.
I wonder what it means for people around the country right now, because to me, looking closely at this, it really feels like we're in a worse place than we were back in March and April as a country because of what is coming and what we're already seeing. But I'm also getting the sense that so many Americans have COVID fatigue. They are sick of not seeing their families. They are sick of not being together. How is that playing into the numbers that we're seeing now and what we could expect to see? And what message do you have for us?
Yeah, you are absolutely on target, Tim. It has a lot of impact. It impacts hospital staff. We're tired too. You know, we're tired and we're wondering how we're going to manage this next wave safely. So there's a few things that, and I just spoke about this with my staff this morning. Communication is mission critical. Transparent, clear, truthful communication, letting people know what you know and sharing it with them in many different ways. The other thing that is important is to know that we will get through this. I think Dr. Fauci talked about it's not going to be a pandemic forever. The vaccines look good. It's going to take some time. We're going to have a very difficult winter. And saying that up front, and how do we plan for that? How do we plan with our families? How do we have those discussions? We have been building what I call our resilience gene here at Johns Hopkins, where we've used a lot of resources to manage some of this unknown and overwhelming response that we just none of us have been through an experience like this. So we're using a lot of the information that we learned from the first wave to say, how can we do it better in the second wave? And one of the other things that we're very clear about here at Johns Hopkins is this is not the year to have a large Thanksgiving celebration.
Yeah, I think that's
difficult.
Yeah,
that's
it's difficult.
To say to
it's difficult, but I think it's helpful to hear that Dr. Fauci say things like this isn't going to be with us forever, and delaying the gratification of seeing family is something that we need to keep in mind because it will do greater good and it will keep us safe. I want to stick on this idea of our first responders, the people like you, the frontline workers, the healthcare workers who have been on the front lines of this for months, who are tired as well. I'm so grateful for what you and all the frontline workers have done around the world. And I know so many people watching are as well. But it makes me wonder also about reports that we're seeing from the Dakotas, for example. Cases are surging there so much that the hospitals there are reportedly allowing asymptomatic personnel to actually work in hospitals. These are people who've tested positive for the virus, but they need them to be working and taking care of patients. How concerning is that to you?
That's concerning to me. I'm not a scientist in that sense. I will tell you as a nurse manager, I just had this conversation with my staff this morning. If you feel as if you are symptomatic, don't come to work, call the occupational health hotline. And that's going to be painful for us who are here working. But as you said, we all have to get in there and get in the trenches and fight this battle for the next few months.
Nisa Ernst, nurse manager at the biocontainment unit of Johns Hopkins Hospital. Thank you so much for your time. Really appreciate it. And we should note, too, that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg. He's the founder of Bloomberg LP and Bloomberg Philanthropies.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.